Welcome to the MamasteFit YouTube channel. In this video, we have Leah Levitan here, who is going to be talking about how you can use lymphatic massage and drainage to help support recovery from a C-section. So thanks so much for being here with us, Leah.
Thanks so much for having me.
Can you just quickly introduce yourself to our viewers who may not be familiar with you and your expertise?
Sure. My name's Leah Levitan. I live in Austin, Texas, and I work with clients in my in-person practice using manual lymphatic drainage. I'm a certified lymphatic therapist and an online educator. So I teach people about their lymphatic systems and how to take care of them.
So after a C-section, there's definitely a lot of recovery considerations that most people are not even told about. They're kind of handed a baby, maybe given some Tylenol, and hopefully given some Tylenol. Good luck. What are some things that somebody can do shortly after having a cesarean birth to help support healing of their incision site and to support their functional health and healing postpartum?
So I see a lot of post-operative clients, people coming in after surgery. Occasionally we get C-section. A lot of times they're pretty busy. They've got their hands full. They don't have time to come and get a massage. So I love the idea of self-care and support for the body after. But the reason that we do lymphatic drainage after surgery is to really help with expediting wound healing. The lymphatic system is such a big part of our immune system that it can really help just speed that recovery up and that tissue repair. And it removes a lot of the swelling, the fluid accumulation that we might get, and it's a natural pain reliever. So using lymphatic drainage can be really helpful, but there are some techniques as well because we really want to be mobilizing that scar tissue, trying to free it up and make sure that as those layers are coming back together, that they're soft and malleable. Fascia is kind of like a spider web, There can be some scar tissue, if it develops a little bit too, if it's not mobilized during that early stage, that can cause a lot of hip pain or low back pain. So to prevent that, we really just want to be showing that scar tissue some lymph love. So self-lymphatic drainage is something that you could find videos online. It's really hard to explain how to do lymphatic drainage for the pelvis on a video without showing you. So I could try, but it's a lot. Maybe, check out my pelvic pain class. I've got self-lymphatic drainage for the pelvis on there. There's so much lymph in the pelvis. But if you want to talk specifically about how to work on the C-section scar, I think that could be great for this type of presentation. Presentation of information.
Absolutely.
Yeah.
So when could someone start doing lymphatic massage? Obviously, we don't want to do anything directly on the incision till about probably closer to 6 to 12 weeks postpartum or post-surgery. What could someone do early on to help support that initial, support the lymph system, to help with the healing, to reduce the swelling, and to help with pain relief?
You can so when we see post-operative clients in our clinic, we are usually seeing them about 3 days after surgery.
Okay.
Oh, okay.
So you can start pretty quick. Yeah. Because that's the inflammatory phase of healing. And that's when that lymphatic drainage is going to be really, really helpful.
Okay.
Okay, so they could start these pretty early on in the recovery.
Okay, that's pretty helpful to know. Is it mostly just with the hands? Are they using different tools? If someone knows that they're going to have a C-section, should they have dry brushes on hand or stones, or is just their hands going to be enough for them postpartum?
Initially, just the hands. Just the hands. We don't really bring any tools into it until they're a little bit more further along in the recovery process after surgery. Some gentle manipulation of the scar tissue is great. We usually will start doing that super, super gently, probably about week 3 or 4. And that's taking 2 fingers and kind of gently doing some, circular motions. And you can use any sort of healing ointment. I love Medi Honey personally. Are you familiar with Medi Honey?
I am not, but I will be looking that up.
Yeah.
Medi Honey is great.
So when we're doing the lymphatic massage, are we pushing towards the scar or are we kind of directing away from the scar?
We're going to go away from it. So if you draw an invisible line down your body and divide yourself into left and right, that's going to be the roof of your house. So lymph is going to drain to one side or it's going to drain to the other. And for the pelvis specifically, like right around where a C-section scar is going to be, that stuff is going to drain to the inguinal lymph nodes in the hip. And I think why so many people get swelling in this area is there's a little channel that runs that connects those lymph node clusters from the left into the right and right side. It almost makes like a little bridge where the lymph will drain like side to side to either go from one side of the body to the other. They're called anastomoses. And so we just they're just like right there in that little high traffic area for fluid. But it actually works out pretty well because that means that the lymphatic system has more options to drain that tissue, which is great.
Okay, so it's going to be kind of from the center outwards, but there's also kind of a drainage down the center is what I'm kind of understanding as well. But we're moving away from the C-section scar.
So it's like, so if this is your C-section scar,
Yeah.
below it, you're going to like the hip creases almost pretty much because your inguinal nodes are like kind of in the middle of your hip creases. So you're going down. What do they do above the incision? Would you just go around the incision and go down? Or what would you do for that top?
Yeah, actually, that's how you can redirect fluid around scar tissue, and that's exactly how we redirect it. So you can kind of work just below the belly button. Everything below from the belly button down is going to drain to those lymph node clusters as well.
Okay.
So pretty much anything down below the belly button, you can just send it down to the inguinal lymph nodes with your hands. And again, it's just like really light, gentle pressure. You're working with the skin. You're not working on it. You're not massaging the muscles. We're really trying to stay just skin deep. That's where a lot of that lymph is. Yeah.
I mean, that just felt nice.
Yeah.
Just for
Would
me.
you recommend any sort of like oil or lotion as you do it at the same time? Or are we wanting that kind of that friction against the skin with the hands?
We want a little bit of friction. So we're using little pumping circles. What you can do, maybe you can see what I'm doing here with my hand, but I'm just kind of doing like a little circle pump situation as opposed to sort of gliding and sliding over the surface of the skin. And that's just trying to manipulate those lymphatic vessels to create more fluid. Obviously, any way that you do it.
So it's like tiny circles as you move towards the lymph?
Yeah, you could almost imagine that you're doing like a windshield wiper motion. You could pump one hand, pump the exactly. It's exactly what it is.
Yeah. And so you do one side at a time with like your two hands, almost like this.
You can do that, or you can just place one hand on either side of the pelvis and just kind of do that windshield wipering.
And just move it like that too. Okay. Oh, one at a time. Okay.
So if someone wants to go more in depth with this, because obviously there's a lot of little techniques and hand motions that could occur, they should join your pelvic lymph drainage course.
Because it's probably like the pelvis itself has like so much.
Yeah. So I did make a course for pelvic pain, and that pelvic pain is such an umbrella term, right? But a C-section would be great for that because it's such a dense area for fluid, and the course itself kind of focuses on the anatomy and physiology of the lymphatic system as it pertains to that area, and then has a lot of different techniques as well. So working in the abdomen, this would be coming a little bit later in the recovery, but the hands-on lymphatic drainage portion is going to be really helpful because, yeah, you have to kind of go in a certain order. The lymphatic system is a pressure system, so it's like you can't pass go and collect $200 until you do X, Y, and Z kind of thing.
Okay.
Okay.
Well, we'll link your course down in the notes below for those of you that are watching this video and you're like, I want more
Yeah.
because this is going to support my healing after
Yeah.
birth, especially after cesarean birth. And we'll link your other resources as well because it's a wealth of information on your YouTube channel, on your Instagram. Like I've learned so much about the lymph system and just how to approach my own self-care. And there's so many things that you can do at home to support your self-care for this really important system that I think is really amazing. Like you don't need, like obviously working with a professional is beneficial as well. For those of you that are in Austin, go see her. But I think it's really awesome that there's so many at-home things that you can
Options,
do
yeah.
to support your health daily. So if someone's had a C-section, how often would you recommend them approach doing lymphatic specific like massage and techniques?
So if you're doing it at home, you could do it 1 to 3 times a week. It doesn't have to take very long, especially if you're working really targeted like that. You know, you're not doing your whole body, you're really spot treating. So I would say start to finish, it would probably take about 15 to 20 minutes. And that's something that you could do if you had a little time to yourself, or if you're just hanging out in bed watching your favorite show while you're breastfeeding. Or however you want to do it.
Yeah.
If you were going to go see a professional,
You could multitask. You like nurse a baby and
Yeah.
totally.
Is there a way to find a professional like in your area? Like obviously Austin, Texas, see you. But if they're not in Austin, Texas, is there like a directory of like lymphatic certified professionals, like lymphatic? I can't remember what you called yourself like
A lymphatic therapist, yeah.
yes, lymphatic therapist. Is there a way like a directory to find people like you?
Yeah, there are a few directories out there. Mostly the schools that teach clinical lymphatic drainage, like the kind that we use in hospitals. Each of those schools have directories, so we should totally link those in the show notes. But it's great if you're just looking on Google. You're going to be looking for specific types of modalities. So the Vater method, that's the training that I have, or the modality that I use. Also, Chickley is a really good one. Foldy, Casely Smith, and I want to say there's one more. Oh, Leduc. And so those are clinical modalities, and you can kind of spell it all out for them in the caption, so you guys can search online for a practitioner that has like that certification. And that's how you'll know that you're kind of working with somebody who, one, is taking it really seriously, but two, is doing it's very like therapeutic and gentle. There are many different types of lymphatic drainage out there, and the cosmetic forms are a little bit intense, a little deeper, a little bit more focused on like the physical appearance of the body. And so they go ham sometimes.
yeah, I think I want the gentle. Give me
I
the
want the
gentle
gentle.
stuff. The
Yeah.
other option is Delta has flights to Austin. And you can just fly there. Or
Other
your
option.
choice of airline. Well, thank you so much, Leah, for coming on our YouTube channel to talk all about lymphatic massage to support C-section recovery. We'll include all your resources down in the notes below for those of you that are wanting to use lymphatic massage to help support your recovery after birth. And then also definitely check out her pelvic pain course because it's going to be specific techniques that you can utilize to help support your healing.
Awesome. Thanks, guys.
Thank you.
Yeah, thank you.